Epilepsy, a condition characterized by recurrent seizures, is a common neurological issue affecting an estimated 1 to 2% of the general domestic cat population. Antiepileptic drugs form the cornerstone of treatment for this condition. While phenobarbital has long been considered a safe and effective initial anti-seizure medication for most cats, there are instances where it may not be well tolerated or where it fails to adequately control seizure activity when used alone. In the canine world, potassium bromide serves as a viable alternative or additional antiepileptic drug. However, its use in cats is associated with significant adverse reactions, including allergic-like pneumonitis, occurring in a substantial proportion of cases, making it a less desirable option. This highlights a critical gap in our knowledge and the limited evidence-based recommendations for selecting antiepileptic drugs beyond phenobarbital for cats. Overall, the researchers concluded that the frequency of laboratory abnormalities was low, although they acknowledged that larger studies with more complete follow-up blood work are needed to fully understand the prevalence of potential adverse effects. The researchers also acknowledged several limitations of their study. A major limitation inherent to retrospective studies is the reliance on information already recorded in medical records, in this case, primarily client-reported seizure frequency. Owners' accounts of seizure frequency can be subjective and potentially unreliable. Studies in dogs have even suggested that owners might underreport the actual number of seizures. This reporting bias could be further influenced by a lack of standardization in how owners were asked about seizure frequency. They might recall periods of increased seizure activity more readily, potentially inflating the reported frequency, or they might miss seizures that occur when they are not directly observing their cat, leading to an underestimation. Additionally, the time periods over which seizure frequencies were evaluated varied between clients due to the retrospective nature of the study. Furthermore, the placebo effect, where a perceived treatment can lead to improvement even if it has no direct pharmacological effect, has been shown to influence client-reported seizure frequency in canine epilepsy trials. And this could also be a factor in feline studies relying on owner reports.